sport these days. What I am going to try and do very quickly is give you a quick summary of what the landscape looks like in the healthcare system today. So the United States in the last year spent $2.4 trillion on healthcare. It represents a significant increase over the previous year, more than double the rate of inflation. The projections for what we're going to be spending on healthcare going forward are significant. $3.1 trillion projected by 2012, $4.3 trillion by 2016. It represents 17% of our gross domestic product. And we're, again, projected to see that increase over the next 11 years. In comparison to some other industrialized Western countries, we're spending a lot more on healthcare in terms of the percentage of the GDP. And one of the things that I want to stress is that there isn't anybody who said we should be spending 20% or 2% or 75% of the GDP on healthcare. But I just want you, as you go through this evening's conversation, to remember that we are outspending our sort of comparable neighbors around the world in terms of our expenditures in healthcare. And what that translates into, every one of the countries, and I'm sure you can read the fine print, represent, these are all, again, industrialized nations. Every single one of them offers some sort of national health coverage. And yet when it comes to per capita spending, we outspend them all. We're spending somewhere in the neighborhood of $6,000 per person per year on health care. We're at the bottom of the graph, and you can see what the rest of the industrialized world, or some of the rest of the industrialized world, is spending. So what do we buy with the money that we're spending? About 50% of it is, I think, where you'd expect it to be in terms of buying services from hospitals and physicians. The rest of the dollars spent, probably the next highest piece, is for pharmaceuticals, and that's about 10%. So that's what it looks like from 2006 on how the healthcare dollar is being allocated. What are we getting for the money that we spend? Everyone talks about the U.S. as a country that has the best healthcare in the world. We've got a lot of advanced clinical treatment. We've got some premier technology available, both in terms of diagnostic and treatment options. We do a lot of work in developing pharmaceuticals, and yet we're one of the few countries in the world for the programs that are nationally administered that do not negotiate prices for the purchase of drugs. What we also get, however, is a very fragmented system of care. As you'll hear a little bit down the path, there are certain aspects of healthcare that are carved out of the quote-unquote medical system. When we talk about dental or oral health care, separate insurance system, separate delivery system, oftentimes considered an optional benefit, but we know that oral health is part of overall health, and there are long-term chronic diseases that are impacted by poor oral health. Mental health is something that gets carved out or whittled down in terms of benefits. So we've got a very fragmented system where folks aren't talking to each other within the healthcare system. Additionally, we see enormous variations in care. Probably most of you at this point have seen references to an article that ran in the June 1st issue of the New Yorker by a Boston surgeon, Atul Gawande, who visited the community in Texas that has, I believe it's the second highest cost per individual, and that's measured by Medicare expenditures. And he went there to figure out why they were different than the rest of the world. And they're different than the rest of the world, not because they have better outcomes. Their outcomes don't really look that great. They don't have sicker patients. So what's the issue? Well, there's a lot of for-profit healthcare going on there, and people have really sort of accepted the religion of the dollars associated with providing healthcare. So there's a lot of over-provision of health services. And our own Dartmouth University has done a lot of studies. There's a group there that's done a lot of studies on the variations in care. And what we are, those of us in the healthcare field, are beginning to understand is that more care is not necessarily better care. And in many instances, it ends up giving us poorer quality care. The more we intervene, the more chances there are to do damage. And obviously there are lots of inefficiencies. Those of you who've wandered through the healthcare system, I'm sure, have encountered them. So we spend more than the rest of the world on healthcare. How do we compare in terms of our outcomes? Well, our infant mortality is higher. We rank 43rd in the world in terms of our outcomes. We have 7 deaths per 1,000 live births. And the really sad thing is that we're falling down the ladder. In 1990, we were 23rd, and in 1960, we were 12th. Our life expectancy, which I think we're all very proud of, again, it looks good to us, but again, we rank 47th in the world in terms of life expectancy. And we are 33% worse than the best country on what they call mortality from conditions amenable to health care. And that means that these are deaths that could have been prevented with timely and appropriate intervention in the healthcare system.